Well, a trip to the dentist probably is not on your list of favorite things to do, but one new procedure may help you avoid a bad experience with the drill the next time you actually have to see the dentist. So stay with us. Welcome back, everyone. You know, a trip to the dentist is probably not on the top of most people's list, but what if you were able to take steps in addition to brushing and flossing, which hopefully everyone's doing at home, right, that could cut down on the number of trips to the dentist? We have Dr. Alison Schwartz from Healthy Smiles Dentistry in Scottsdale joining us this morning to talk a little bit about a procedure called dental sealants, and you brought along a couple of your patients here with you.
Dental sealants have actually been around since about 1960, but most people don't know anything about them.
What exactly is it? Let's talk about what exactly a dental sealant does.
It's basically a resin that we apply to the grooves of the back teeth, and that doesn't allow any bacteria or food to stick in the back teeth where most people get their cavities.
So it prevents cavities is the number one step that this does.
Yep.
Okay, and you have 9-year-old Adler and 11-year-old Sydney who have both had them done. How are you guys this morning?
Good.
Good. All right, let me ask you, Adler, how many teeth do you have sealed? Do you know?
3.
3. Do you remember when you sat in the dentist chair and the dentist did that for you?
Yeah.
And what did it feel like?
It didn't hurt that bad.
Good job. So it was fine. I hope you got candy or a sticker afterwards.
No candy.
No candy. Oh, I'm sorry. Oh, yeah, I forgot. The dentist. Okay, not a good call. Dr. Schwartz, then talk about who's a candidate for this. We have 2 children, obviously, who've had it done. Sydney, all 16 adult teeth?
Yes. It's common to have your molars, which you'll have a total of 8 of those once you get all your adult teeth in. But I also like to seal the premolar teeth because they have a similar groove system that things get stuck in.
Okay, and what does the procedure look like? We're looking at some pictures. How long does it take? What exactly are you going in there to do?
It's pretty quick. The samples that I have up here is that we'll check a tooth to make sure it doesn't have a cavity, and we have laser detection for that.
So it has to start with a healthy tooth?
Correct.
Okay.
And then we use aluminum oxide in a real thin powder point and clean the surface of the tooth off. And then we'll take a tooth like this, and all we do is just squirt the sealant onto the surface of the tooth, and it will typically turn like a bright white.
Of course like that happened, yeah.
And then you take the light, and you just hit it. And that
seals it.
Yep.
Okay.
And that's about that fast. And that's it.
Really?
It has no taste to it. It doesn't hurt. Extremely conservative and a lot less expensive than having to have a filling done.
Is it covered by some dental insurance?
Absolutely.
Absolutely. Okay, very good. And Sydney, tell us what you do to make sure you're being healthy with your teeth.
I brush them morning and night, and then I floss after every meal.
And you have 16 teeth that I hear that are sealed. Do you remember, did you get them all done at once? Have you gotten them over time, or did you have cavities?
All done at once.
All at once? Wow, and do you remember if it was fast? What were you doing?
It didn't hurt at all, but the sand got in your face, like, because the teeth.
She's like, is it okay if I'm saying that?
Fine.
I know she had that look. Well, that's awesome. And then do you guys have any cavities now, either of you?
No.
No? And what about you, Sydney? None either?
Not that I know of.
And a lot of kids, cavities are very common. How big of a problem is it?
You have about an 85% chance that you will get a cavity in a back tooth if you've never had it sealed or filled.
Wow, okay. You brought along a few other products to make sure that folks are taking care of their teeth, especially the children. What do you suggest to make it top-notch, great health care for your teeth?
Electric toothbrush is a must. It does a far better job than the manual toothbrush can do. Products with xylitol in it will actually force the bacteria that lives in your mouth to eat an undigestible sugar.
So look for xylitol.
And
is
then
that
it can't
in
hurt
many
the
of the
teeth.
products now out there out on the store shelves?
No.
No.
Typically, you have to find them in the dental office, and then once you get them there, then you can access them online.
Okay, very good. Dr. Schwartz, again, is with Healthy Smiles Dentistry out in Scottsdale. We have all the information on azfamily.com if you'd like more information. Thanks for coming in this morning, Sydney and Adler.
Thank you.
We appreciate it.